Monica Radcliffe has been practicing in the field of occupational therapy for almost 10 years. She started as a certified occupational therapy assistant and then completed a bridge program to become an occupational therapist. Monica has worked in many different areas throughout her career. For the last year and a half, she has been working at On With Life in Ankeny, where she specializes in neurodiagnoses. Monica enjoys working with the neuro population as it challenges her in many ways in order to help her clients succeed and live their lives to the fullest. Please welcome Monica Radcliffe.
I guess good afternoon, everybody. Thanks for joining me today. As she said, I'm going to be talking about how to get on with life after a brain injury and then how occupational therapy is involved. We're just going to kind of start off, talking about what is a brain injury. A brain injury is damage to the brain that can affect its function, and it can be caused by a variety of factors. It can be physical trauma, lack of oxygen, infection, and medical conditions. There's 3 different classifications of a brain injury. They can range from mild to severe. Mild is a brief loss of consciousness, if any, dizziness, confusion, or headaches. People can usually recover fully with rest and rehabilitation. A moderate level this might involve a longer loss of consciousness, confusion, and memory problems. Some long-term effects may remain, but recovery is still possible with therapy. Severe brain injury, this could result in a long-term coma, persistent vegetative state, or a significant cognitive, motor, or emotional impairment. Recovery can be prolonged and the individual may require extensive rehabilitation. So there's different types of brain injuries. There's 3 different types. They are traumatic brain injury, acquired brain injury, and a concussion. A traumatic brain injury is an external force that can cause damage to the brain. This could range from falls, motor vehicle accidents, sports injuries, violence or assault, and blasts. They can be closed injuries, where the brain is injured but the skull is not, or a penetrating injury, where this enters the skull and damages the brain. An acquired brain injury occurs often after birth due to the factors unrelated to external trauma, like stroke, which is a disruption in the blood supply to the brain, anoxia or hypoxia. This is when the brain is deprived of oxygen, which can happen during events like drowning, cardiac arrest, or respiratory failure. Brain tumors, which is abnormal growths in the brain that can cause pressure and damage brain tissue. Infections, brain infections such as meningitis or encephalitis. This can cause inflammation and damage to the tissue. Toxins or drug overdose, which is certain substances that can lead to brain injury, either from direct toxicity or by disrupting the brain function. And then, or a concussion. This is a mild form of traumatic brain injury that often results from a blow to the head or body. The symptoms may be temporary. They can affect cognition, balance, and mood. Occupational therapy works with all of these types of brain injuries and at all different levels. So what are some impact of brain injuries? They can cause many different barriers. They can cause cognitive, physical, sensory, emotional, or behavioral impacts. Cognitive effects. This is problems with memory, attention, concentration, decision making, or problem solving. Physical effects can be difficulty with movement, coordination, speech, or balance, depending on the area of the brain affected. Sensory effects are vision, hearing, and other sensory issues that may result from the brain injury, depending on the affected area of the brain. Emotional and behavioral effects are mood swings, irritability, anxiety, depression, or changes in personality and behavior. Occupational therapists are trained in all of these areas in how to treat and rehabilitate people and get them back to living their lives. So that being said, what is occupational therapy? I don't know, and you can just write in the chat if anybody wants to, if they know what occupational therapy is, or if they've had occupational therapy before. If you want to just kind of write in the chat and I'll kind of look here. Okay, so what is occupational therapy? Occupational therapists, they help perform everyday activities, also called occupations, that are important to people. We can assist in making people become as independent as possible following the injury or diagnosis. Yep, and there's a lot of different things that we do as well. We'll kind of get into that. All right, so what are the goals of OT with the brain injury recovery? The general goals of OT and brain injury recovery. We maximize independence, adapt to the environment, and promote cognition and emotional health. So how do we maximize independence? Well, we help the individual return to as many daily activities as possible, and we try to make them as independent as possible or as safe as possible to be able to do that. And how can we help them maximize? Well, we can adapt the environment if needed, where we can modify the home or workplace environment to ensure the safety and accessibility. So that could be if like adapting things would be like ramps, grab bars. You can do a lot of things with smart homes these days. So just different ways of making it possible to be in your own environment. And then we also promote cognitive and emotional health. So this is where we ensure recovery isn't just physical, but it's also cognitive and emotional. So we help them regain the confidence and adjust to the changes that they're looking at. And as OTs, we're very known to look at the person holistically. So we're not just looking at one main thing, we're trying to figure out how the person can be who they want to be and what we have to do to get them there. So what areas do we address? We address cognitive, improve physical function, emotional behavior and support, activities of daily living and instrumental activities of daily living, vision assessments, return to work, and return to drive. So some cognitive rehabilitation, where I work here, we work really in conjunction with speech therapy. We are an outpatient setting. So this is where, we're great to have all of these resources and different people that we can work with. So how do we work on that and address that? We focus on attention, memory, problem solving, and executive function. We can provide memory aids, cognitive exercises, and compensatory techniques. With the physical function, this can consist of motor function and coordination and balance and mobility training. You see a lot of this happen after a brain injury because depending on the part of the brain that's affected, it can come out in different areas of your body. So we're looking at how, if somebody lost function of their arm, what can we do to help with that and help improve it? So this can be like fine motor skills, hand-eye coordination, gripping, typing, etc. We exercise to help with strength and mobility. And then we also can provide adaptive tools if needed, if we're not getting full function of what we're trying to do. How do we do balance and mobility? Well, this is, once again, I work with physical therapists and in our outpatient setting, and they do most of our mobility and balance, but we like to work on it in our sessions to have carryover because you need balance and mobility in order to do your activities of daily living. So we work on posture and balance through exercises. We help patients regain confidence with their movements during all of this stuff. And then we provide safety strategies to prevent falls and injuries. I think this one really keys into how can we help with showers in particular, because that's one of the main things, where balance can be affected. And this is where adaptive equipment would come in, where we could provide, handheld showers, shower benches, grab bars, and just, helping caregivers address this as well. So we're not just helping the person, we're also helping caregivers so that they can help get their person back to recover. Emotional and behavioral support. This is psychosocial support. So we manage the emotional reactions to brain injury. So a lot of times you see frustration, anxiety, and depression following a lot of these injuries. So we help build coping skills to change self-esteem and kind of find that identity that you kind of might not sure where you are or what you need. And so we can help kind of bridge that gap. Here we work with counselors. We have a lot of counselors that we refer to, or we even have some in-house. So it's kind of nice that we have that support as well. Behavioral strategies, we address impulsivity or aggression and tailoring our interventions to help with social interaction and communication. A lot of times, you're dealing with the behaviors following the brain injury, and we're trying to help them interact with people and get back to doing the things that they love. So this I would pretty much consider the OT's like bulk of what our main existence kind of, where we focus a lot on, and that's the daily living skills for activities of daily livings and and IADLs. So this is like your self-care training and household tasks. This is where you want to be independent. Before your injury, you might have been doing these things on your own. So how do we get you back to doing them safely or doing as much as you can as independent as possible? So this is, we rebuild the ability to perform activities like dressing, bathing, and grooming. We can adapt the environment for access. We can reintroduce like household chores, meal prep, and laundry, but how can you do that safely? Or do you need a modification, or do you need a tool to help you with that? And then we can modify like your work environment, time management, and productivity tools. These next three are kind of, I would say, a little bit specific to where I work, but we do address these areas here, and I feel it's one of the great tools that we have. In our evals here, we do a lot of comprehensive vision assessments, and this is where, people don't realize that eyes can be affected in more than just what you're seeing. When the brain is injured, sometimes your vision can be skewed in a way that you didn't really understand till we ask you some of these questions. So we do comprehensive visual scans or ocular motor function. Many people suffer from deficits, and we can help with range of motion exercises, treatment plans to assist with the deficits. And then we often refer out to neurooptometry here in the metro. We've worked closely with some of the places around here because they do more comprehensive eval and kind of can help guide what we're doing and give necessary, like if they need a specific glasses or prisms to help so that they can function and their eyes are not limiting some of that. And then we also help with return to work. Our speech therapy department is kind of our bulk here, but we also, that's very important occupation for a lot of people. We don't help you get a job, but we can help you, getting you back to work and trying to figure out, do you need a accommodation? Is there something else, other kind of job that you need to focus on, or where can we help you in that area? And then we also have a return to drive program here. We've been building this and making it more, I don't know, it's kind of trying to build it up here as well, because we do have a simulator in our facility, and we do on the road evaluations here as well. So this helps people, if they need to go back to the DOT at some point because they lost their license, we can assess things here and kind of see, is returning to drive a possibility? I mean, that's a big independence factor for many people. And some people are able to return, but they need restrictions. But sometimes, it just gives them an insight, is driving really your priority at this moment, or what do we need to do? So we have a simulator, and we also have a Dynavision that really works on like a reaction time and functional reach. So it's kind of nice that we have that equipment here, and it kind of sets us apart in how we can, help people regain that independence. I feel like that's one of the main places that people, when they come to us, they're like, I can't drive anymore. So how am I supposed to get places? I have to rely on people. So I feel like this is kind of important and specialized kind of within the OT community. We address all of these areas by the types of interventions that we provide. So now I'm going to kind of go into like the role of the OT and how the process works. It all begins with the evaluation. So this starts, once we get the order from the physician, we complete a chart review and we look at all your prior medical history and kind of your current medical history and what's going on and what brought you to us. During this process is when we're speaking with you and your caregivers, family members, doctor team, kind of depending on what setting we're in and how we can make sure that our plan of care is centered around the person specifically. So we want, it's interactive, open communication for the client and interviewing, and their family. What do they want? What are they seeing? What are we wanting to get out of therapy? Do they even know what therapy is? What can occupational therapy do for them? Because a lot of people, when I ask what occupational therapy is, they're like, I don't need a job. I already have one. Well, that's not what I'm here for. I'm here to help you try to regain some of that independence and move on. So after we do the evaluation and we kind of get the interview done, this is, throughout the whole process, we're talking about goals. So standardized assessments can help us through this part. A lot of times, after brain injury, sometimes we're looking at the body. Are you able to move? Are you able to get dressed? Are you able to use your hands? Are you able to feed yourself? Are you able to brush your teeth? Can you get in and out of the shower? Do you have to have a wheelchair? I mean, there's all different things that we're looking at. So depending on your focus and where we're at right now, this is where the goal setting starts. And a lot of times, we have short-term goals and long-term goals. So we set more realistic. We want to be realistic with these goals, but we also want to hear what the person wants. And then we go from there and set them appropriately. So then this is all part of the plan of care and development. So once we've established our goals, this is where we set up a frequency and talk about the duration of your plan of care. This kind of all depends on what setting you're in, and I'm going to talk about that here in a little bit. But here at On With Life, we're outpatient. So our frequency, it really depends on what we feel like the people need. I mean, we see people, you can see them every day, but typically we are seeing people 2 to 3 times a week. And we set our plan of care, typically for 90 days, but that does not mean that's how long or how short we're going to see someone, because we're constantly assessing and making new goals and kind of seeing where we are. We also here at On With Life do what we call as episodic care, where a lot of times once you're here with us, I like to say we like to see you keep coming back, because with brain injuries, they kind of are ongoing for your whole life. And we want to make sure that you can still live throughout life. And once we see you the first time, we get you to an area where you feel comfortable. That doesn't mean 3 or 4 months down the road that something new doesn't come up. Or going back to the driving scenario, say you weren't appropriate at this time, but you're going to be appropriate the next plan of care. So it's an ongoing situation where we're continually looking at how you're performing, what you want to be able to do, and how can we get you there. And then we're always talking about discharge planning from day one. So this is also dependent upon what setting you're in and where you're seeing us. We need to know what we're striving for, where we are intending to discharge, and what level is expected versus where we might think you actually will be. So discharge planning is very important. I don't know, we're constantly talking about right away, because we need to know what level you want to be at. All right, so I'm going to talk about kind of some of the different settings that we're in. Oops, wrong button. Okay, so the types of setting we provide occupational therapy, you can see for brain injury would be in a hospital, inpatient, skilled nursing facilities, home health, and outpatient. Hospital, we're seeing people at an acute and a subacute level. Our main priority here, we're just trying to get, as long as you're medically stable, we're trying to get you up and out of bed and moving depending on what level you are in. A lot of times you go through the Rancho scale, And, are we just even trying to get you to interact and respond with anybody, or just plain as simple as trying to wash your face, just what level are we at and what do we need to do to even just get you moving? Inpatient, this typically is a subacute or is following an acute or subacute hospitalization. A lot of people get admitted into it but they have to tolerate up to 3 hours of therapy in a day in order to go here. So, sorry. There we go. And then some people, if after hospitalization, if they are not ready to go home, but they are not appropriate for an inpatient, they might go to a skilled nursing facility. This is where you work on basic functions and try to regain independence so we can get you either home or to where a place that you are ready to go to. And then there's home health. This is where, OT, I feel like, is very crucial too, because you're in the home setting where you're working one-on-one with people in their actual setting to make them feel, and you can kind of get a sense of where they're at in relation to that. And then outpatient, we're working and looking at people holistically to work on all areas that are still a concern. This may be, we're working on function and independence, but where were you when you left the hospital? Where were you when you left inpatient? Where were you when you left skilled? Do you still need some type of therapy, but you're not homebound? So you can travel and come to an outpatient clinic, and this is where we see people in all areas of life or all areas of their diagnosis, and no matter where they are in their journey. So some types of interventions that occupational therapy provides. We work on task simulation, environmental modifications, assistive technology, therapeutic exercises, and we have support groups. So once an evaluation is completed and a plan of care is established with the client-centered goals, interventions are provided to help reach these specific goals. And I would say too, the interventions kind of depend on which setting you're in and kind of where we're striving to go. So for task simulation, we can create realistic scenarios. This is to help regain skills. So if you need to be able to cook, like cooking was one of your goals, we need to see how safe or if you can follow directions. We can simulate a task, or where I work, we're lucky enough that we have an actual kitchen. So we can actually bake, or, if there's something specific that you had in mind, you can prepare ahead of time, give us the recipe. You can go and shop and bring your ingredients, and then we make it here. A lot of times too, where we're able to do in our setting, we can collaborate with other therapies, and it can go from one session to the next where you're working on multiple things at once, not just the cooking itself. Environmental modifications. So this is where we're adapting your home or your workplace to make the task safer and easier to perform. So a big one, going into someone's home, I've done multiple home assessments. Is it safe, like depending on what level of care you need, do you have things that are going to be a fall hazard? So would we need you to pick them up and remove them, or get a different type of rug, or do you need grab bars in your bathroom? Do you need some, like the doors widened to get the wheelchair through? All different things. We just come in and we can assess your home and help you modify. Or in the workplace, if we typically don't go to the workplace, but you can bring in pictures, we can kind of help you. Do we need to put your computer at a different level? Do you need a different kind of chair? Do you need different rest breaks and all, or do you need a ramp or specialized seating, just to kind of make things more accessible to you so that you can return to the things that you were doing before. We work with assistive technology. So if you're unable to use a body part like your hand to be able to reach out and push a button, a lot of things can be controlled by these voice activated things, due to a lot of our smart technology in this day and age. We can modify keyboards, we can adapt tools to improve independence. I don't know, like the wheelchairs can be controlled with your head. Just we can work on a whole bunch of different assistive technology, especially for low, if your vision is affected, we can help you adapt your stove, adapt your microwave. Therapeutic exercises. This is more, not necessarily specifically exercise, but this is where we can get you stronger, enhance your motor skills, coordination, and strength. So a lot of times, that fine motor and gross motor piece is where we're trying to regain the functional use to make you be more independent. So we're very lucky and fortunate. I like to play games, and you would be surprised how many games can actually be incorporated into a treatment session and not just as a game. I mean, there's lots of games that have small pieces. They take a lot of cognitive strategies to play. It's very a deck of cards is actually one of my best tools. And there's so many things you can do with a deck of cards to help people and improve a lot of different areas of the body. And then support groups. So we do actually here at On With Life, which is very fortunate too, we do have support groups. And just like, the Brain Alliance, we're here to help you because you're not alone. And there's many people out there that need, they want to talk through things and they need the support, and we can provide that peer support, and we can help you locate different support groups that would also give you experiences in learning coping strategies. I think this is one of the best things, is that you get into a group of people because you do need that outside support. It's very beneficial to have. One of the main things for occupational therapy and how we can help you recover, early intervention. Why is early intervention important? Does anyone know why you think that it'd be important to intervene as soon as possible? Exactly. Yep. We want to make sure, we don't, you have deficits, but can we intervene right at this moment and try to stop before things do progress? Or, depending on what setting you're in, like how can we make your life better than what it already is? It also is significantly improves the chances of recovery, and it allows us to assess and begin the recovery process. So early intervention is very important. Okay. Another thing we are very fortunate to, and I think it's very crucial for the recovery process, is that we collaborate with other healthcare professionals. We work very closely with neurologists and physicians. This is where we're getting our orders from. Without the order, we can't do the therapy. So a lot, the physicians and neurologists need to know who and where they're sending you to make sure you're getting the care that you need. And then we also collaborate with our physical therapists and speech therapists. Without working with them, it would be hard to kind of progress people too. We can't, as an occupational therapist, I can't do everything. And I rely heavily on my counterparts to work on different deficits and improve people altogether, because we need all function and everybody on board. And this is kind of where we address too, are we doing what's right for the person or patient, and are we progressing them appropriately? So it's often a multidisciplinary approach that we need here. And then we work also with psychologists and social workers in different settings. This is, the social workers are the ones that are helping with discharge planning. So they often come to us to be like, where are they ready to go home? What do they need in place? What might else they need? What other resources can we offer? And so this is where a lot of times they're coming to us to ask those questions. And then psychologists, like I said, we have counselors here that we work closely with our people, because they need that other person to help with the mental and emotional adjustment that we're not able to help with. So here's where we go. What is occupational therapy? And why is it an important part of brain injury recovery? Can anyone answer that before I go into it? Yeah. Yes. So OTs help perform everyday activities, also called occupations, that are important to them. We assist in making people become as independent as possible following the injury or diagnosis. Occupational therapy enables individuals with brain injuries to regain independence and improve their quality of life. Whether it's through regaining the ability to perform daily activities, adapting to changes, or managing emotional challenges, OTs can provide personal, holistic care and help individuals live their life to their fullest despite their injury.